Welcome to today's deep dive into one of the most significant healthcare policy developments of December 2025, where the Trump administration has announced sweeping proposals that could fundamentally reshape access to gender-affirming care for transgender youth across America. And I want to take you through every aspect of this complex story, from the policy details to the medical evidence, the political context, and the human impact. So let's begin by understanding exactly what happened on December 18th, 2025, when the Department of Health and Human Services, under Secretary Robert F. Kennedy Jr., unveiled what experts are calling the most forceful federal attempt yet to restrict transgender health care for minors. And these aren't just minor adjustments to existing policies. These are comprehensive regulatory actions that could effectively ban such care nationwide, even in states where it remains legal. So what exactly are these proposals, and how do they work? Well, the administration has put forward two major rules through the Centers for Medicare and Medicaid Services, commonly known as CMS, which oversees the massive federal healthcare programs that cover over 140 million Americans. And the first rule would prohibit federal Medicaid and Children's Health Insurance Program fund from being spent on gender-affirming care for people under age 19, which means that even in states that currently allow and cover this care through their Medicaid programs, federal dollars could no longer be used for treatments like puberty blockers, hormone therapy, or surgical procedures for transgender youth. But the second rule goes even further and represents what legal experts are calling an unprecedented use of executive power, because this rule would change the fundamental conditions for hospitals and clinics to participate in Medicare and Medicaid programs by barring any facilities that offer gender-affirming care to minors from receiving any federal funding at all. And let me emphasize how significant this is. Nearly all hospitals in America participate in Medicare and Medicaid. These programs are the backbone of the American healthcare system, covering seniors, people with disabilities, and low-income Americans. And for hospitals, losing this funding would be financially catastrophic, essentially forcing them to choose between providing gender-affirming care to minors or maintaining their ability to serve Medicare and Medicaid patients across all services. And Hannah Oliason, an attorney at Nealon Johnson Lewis who works with hospitals, described this as effectively forcing providers to discontinue such services or risk losing Medicare and Medicaid funding entirely, which would be an impossible choice for most healthcare institutions. Now you might be wondering what exactly constitutes gender-affirming care. And this is important to understand because there's often confusion and misinformation about what these treatments actually involve. So let's break it down systematically. Gender-affirming care is a comprehensive, individualized approach that focuses on the needs of each young person. And contrary to what some critics suggest, it doesn't mean immediately putting children on hormones or performing surgeries. In fact, the process typically begins with psychological evaluation and support, where young people who experience gender dysphoria, which is the clinically significant distress caused by a mismatch between their assigned sex at birth and their experienced gender identity, are first evaluated by a team of professionals including mental health providers, pediatricians, and endocrinologists. And many young people may first undergo social transition, which involves non-medical steps like changing their name, pronouns, hairstyle, or clothing to align with their gender identity. And research has consistently shown that simply affirming a young person's gender identity through these social measures is associated with better mental health outcomes. But for some youth whose gender dysphoria persists and intensifies, medical interventions may be considered. And these typically follow a careful, staged approach, starting with puberty blockers for adolescents who have reached the early stages of puberty. And these medications temporarily pause the physical changes of puberty, giving young people and their families more time to explore their gender identity without the distress of developing secondary sex characteristics that don't align with their experienced gender. And importantly, the effects of puberty blockers are reversible. If the medication is stopped, puberty resumes its natural course. Then for older adolescents who continue to experience persistent gender dysphoria, hormone therapy might be considered, which for transgender girls means estrogen to promote feminine physical characteristics. And for transgender boys means testosterone to promote masculine characteristics. And these Hormones do cause some permanent changes, which is why they're typically not prescribed until the mid to late teenage years after extensive evaluation and counseling. And finally, surgical interventions are quite rare for minors. The vast majority of gender-affirming surgeries are performed on adults, and when surgery does occur for minors, it's typically limited to chest masculinization surgery for transgender boys in their late teens, while more complex procedures are generally reserved for adults. So, with that medical context established, let's examine the Trump administration's justification for these proposed rules. Because administration officials and conservative supporters argue that this care is experimental, dangerous, and that children cannot consent to such significant medical decisions. And they characterize these treatments using inflammatory language like chemical and surgical mutilation of children, terms that medical professionals strongly reject as both inaccurate and harmful. And Secretary Kennedy has claimed that the quality of evidence regarding the effects of gender-affirming care for minors is very low, which directly contradicts the position of virtually every major medical organization in America. And this brings us to one of the most crucial aspects of this story. What does the medical evidence actually say about gender-affirming care? Because this isn't a matter of opinion or ideology, it's a question that can be examined through rigorous scientific research. And the evidence base is actually quite substantial, with dozens of peer-reviewed studies examining outcomes for transgender youth who receive this care. So let me walk you through what the research shows, starting with mental health outcomes, which are particularly important given the severe mental health disparities that transgender youth face. And according to the Trevor Project, which conducts extensive research on LGBTQ youth mental health, 54% of transgender and non-binary young people reported seriously considering suicide in the past year, and 29% reported actually attempting suicide, which are staggering statistics that underscore the urgency of providing effective care. And study after study has found that access to gender-affirming care is associated with significant improvements in mental health. For example, a 2022 study published in JAMA Network Open, which is one of the most prestigious medical journals, followed transgender and non-binary youth over 12 months after initiating gender-affirming care and found that those who received puberty blockers or hormone therapy had significantly lower odds of depression and suicidality compared to baseline, with the study authors concluding that gender-affirming medical interventions were associated with lower odds of depression and suicidality over the follow-up period. And a Trevor Project study found that transgender youth with access to hormone replacement therapy had substantially lower rates of depression and were at lower risk for suicide compared to those who wanted but couldn't access such care. And research from Stanford University School of Medicine found that positive mental health outcomes were higher for transgender people who accessed hormone therapy as teenagers compared to those who accessed it as adults, suggesting that earlier access to appropriate care leads to better outcomes. And a study published in the New England Journal of Medicine, which is arguably the world's most prestigious medical journal, found that 2 years after initiating hormone therapy, transgender youth reported higher levels of life satisfaction and positive effect, and lower levels of gender dysphoria, depression, and anxiety. And these aren't isolated findings. A comprehensive 2025 systematic review published in The Lancet examined 28 studies, including 4 randomized controlled trials and 24 longitudinal studies, and found that gender-affirming care may improve quality of life, reduce stigma, improve utilization of health services, and enhance mental health. And crucially, the review found that no studies identified significant negative outcomes or harms from this care. And when we look at the question of regret and detransitioning, which critics often raise, the data shows that regret is actually quite rare, with studies finding detransition rates as low as 1 to 2%. And importantly, when detransition does occur, research shows it's most often due to external factors, like family pressure, discrimination, or economic barriers rather than genuine regret about their gender identity. And a recent study published in Pediatrics followed over 300 transgender youth for 5 years after their initial social transition and found that over 92% remained consistent in their gender identity throughout that period. which contradicts claims that most children who express transgender identities will change their minds. Now, this robust evidence base is why every single major medical organization in America supports the provision of age-appropriate gender-affirming care. And I'm not talking about fringe advocacy groups. I'm talking about organizations like the American Academy of Pediatrics, which represents 67,000 pediatricians, the American Medical Association, which represents over 250,000 physicians, the American Psychiatric Association, the American Psychological Association, the American Academy of Child and Adolescent Psychiatry, the Endocrine Society, and dozens of other professional medical societies representing millions of healthcare providers, researchers, and mental health professionals. And these organizations have reviewed the evidence and concluded that gender-affirming care is medically necessary, evidence-based, and often life-saving for transgender youth who need it. So when the Trump administration claims the evidence is very low quality, they're taking a position that contradicts the overwhelming consensus of medical expertise. But let's be clear about something important. Supporting evidence-based gender-affirming care doesn't mean every child who questions their gender identity needs medical intervention. In fact, most children who experience gender nonconformity or gender questioning do not require medical treatment. And the gender-affirming model of care that medical professionals advocate for is explicitly not a railroad to hormones and surgery, as some critics characterize it. Instead, it's a careful, watchful, conservative approach that involves extensive psychological support, family counseling, and exploration of gender identity without judgment or assumptions, and medical interventions are only considered for adolescents who meet strict criteria, including persistent, well-documented gender dysphoria, the capacity to consent to treatment, well-controlled mental health conditions, and family support. So now let's turn to the political context of these proposals, because this isn't happening in a vacuum. It's part of a comprehensive, coordinated campaign by the Trump administration and Republican lawmakers to restrict transgender rights across multiple fronts. And this campaign began literally within the first week of President Trump's second term, when he signed an executive order declaring that the United States recognizes only two unchangeable sexes and that the government will not fund or support the so-called transition of child from one sex to another. In that order, which described gender-affirming care using terms like chemical and surgical mutilation and maiming and sterilization, also sought to block federal funding from hospitals that provide this care to minors. And while that order was later blocked by federal judges who issued temporary restraining orders, it set the tone for what would become a relentless series of actions targeting transgender Americans. And in May 2025, HHS released a controversial review, declaring that the quality of evidence regarding gender-affirming care for minors is very low, despite the position of major medical organizations. And throughout 2025, the administration has threatened to pull federal funding from sex education programs that mention transgender people, which they refer to as gender ideology, and by November, 11 states and 2 territories had complied with these threats. And in October, the administration blocked student loan forgiveness for any public worker or group involved in providing gender-affirming care to trans youth, which means teachers, social workers, and healthcare providers at public institutions could lose access to loan forgiveness programs if they support transgender students or patients. And the FDA announced it would issue warning letters to manufacturers and retailers of chest binders for minors, alleging illegal marketing. And there were even discussions within the Justice Department about limiting transgender individuals' right to keep and bear arms, which drew condemnation from both LGBTQ rights groups and gun rights organizations like the National Rifle Association. And this brings us to what happened just one day before the HHS announcement we're discussing, when on December 17, 2025, the House of Representatives passed a bill that would charge doctors with a felony punishable by up to 10 years in prison if they provide gender-affirming care to minors. And this legislation, introduced by Representative Marjorie Taylor Greene, represents the harshest federal penalty for doctors providing this care ever passed by the House, though it's expected to die in the Senate where 60 votes are needed to overcome a filibuster. But it demonstrates the intensity of the political push against transgender health care, And it's important to understand that this federal campaign builds on an already restrictive environment at the state level. Because before these federal proposals, 27 states had already enacted laws restricting or banning gender-affirming care for minors, meaning more than half of U.S. states already prohibit this care to varying degrees, and federal judges have struck down bans in Arkansas and Montana as unconstitutional, with legal fights continuing. But the proposed federal rules would go far beyond these state bans because they would effectively end access to care even in the nearly 24 states where treatments remain legal and are covered by Medicaid. And this is where the financial leverage becomes so powerful, because states that want to maintain Medicaid coverage for gender-affirming care would find that federal dollars couldn't be used, and hospitals in those states would face the impossible choice between providing this care and maintaining their participation in Medicare and Medicaid, which would be financial suicide for most institutions. So let's talk about what this means in practical terms for transgender youth and their families, because behind all these policy debates and legal arguments are real people whose lives are being profoundly affected. And even before these rules take effect, if they ever do, they're already having what experts call a chilling effect, meaning that hospitals and clinics are preemptively ending their gender-affirming care programs in anticipation of federal action. And many programs that existed in states where care is still legal have shut down, leaving families scrambling to find care for their children. And according to advocates and medical providers, the fear and uncertainty is taking a severe toll on transgender youth and their families, with many reporting increased anxiety, depression, and even suicidal ideation as they face the prospect of losing access to care that has been helping them. And some families are being forced to make the incredibly difficult decision to relocate to other states or even other countries to ensure their children can continue receiving medical care, which tears apart families, disrupts education and careers, and imposes enormous financial and emotional burdens. And as Katie Keith, director of the Center for Health Policy and the Law at Georgetown University, points out, this represents an unprecedented use of federal power to control what medical care is available in hospitals, going far beyond anything previous administrations have attempted. Now, supporters of these restrictions argue they're protecting children from making irreversible decisions they might regret, and that the American people support these limitations, pointing to opinion polls showing that 66% of Americans oppose Medicaid coverage for gender transition procedure for minors. And Terry Schilling, president of the American Principles Project, a conservative advocacy group, has said these restrictions are very good and will change the entire transgender industry by taking away funding streams, arguing that if people want sex trait modification procedures, they should pay for them themselves. But opponents argue this framing fundamentally misunderstands both the medical reality of gender-affirming care and the constitutional and ethical issues at stake. Because first, characterizing this as an industry motivated by profit ignores the fact that these treatments are recommended by medical professionals based on clinical need, not financial incentive. And second, the argument that people should just pay for this care themselves ignores the reality that most families cannot afford to pay out of pocket for ongoing medical treatment, effectively denying care based on economic status. And third, and perhaps most importantly, this isn't just about money or politics. It's about the fundamental question of whether doctors, patients, and families should be allowed to make medical decisions based on evidence and individual needs, or whether the government should override medical expertise and parental authority to impose a one-size-fits-all ban on certain treatments. And as Rodrigo Hong, Leighton Inn, senior vice president at the Trevor Project, put it, these changes represent a one-size-fits-all mandate from the federal government on a decision that should be between a doctor and patient, and medical ethicists have raised serious concerns about the precedent this sets. Because if the federal government can use funding leverage to ban specific medical treatments that have the support of major medical organizations, what's to stop future administrations from doing the same for other controversial treatments like abortion care, contraception for minors, or even vaccinations? And this is where we need to address the legal and procedural reality of these proposals. because it's crucial to understand that these rules are not final or legally binding, at least not yet. The federal government must go through a lengthy rulemaking process that includes periods of public comment, during which medical professionals, advocates, affected families, and the public can submit feedback, and then the agency must review and respond to substantive comments, and may need to revise the proposed rules based on that feedback, and only after that process is complete can final rules be issued. And even then, they're almost certain to face legal challenges in federal court, with opponents likely to argue that the rules exceed the administration's authority, violate the Administrative Procedure Act, infringe on parental rights, and discriminate against transgender individuals in violation of the Constitution. And we've already seen how previous attempts to restrict gender-affirming care through executive orders were blocked by federal judges. So the legal battle over these rules, if they're finalized, could take months or even years to resolve. But even during that process, the proposed rules are having real effects, because hospitals and healthcare providers don't want to risk running afoul of federal regulators. So many are choosing to err on the side of caution by ending their programs now rather than waiting to see how the legal battles play out. And this is causing immediate harm to young people who are already receiving care, some of whom are having their treatment abruptly interrupted in ways that can be medically dangerous and psychologically devastating. And new patients who need evaluation and treatment are finding fewer and fewer places that will see them. So let's zoom out and look at the broader implications of this moment, because what we're witnessing is not just a healthcare policy dispute. It's a fundamental clash over the role of medical evidence in policymaking, the limits of government power over personal medical decisions, and how society treats vulnerable minority populations and the transgender community, particularly transgender youth, represent a tiny fraction of the population. Current estimates suggest that about 0.5 to 1.6% of adults identify as transgender, and the numbers are similar or slightly higher for youth, which means we're talking about a small, vulnerable population that faces disproportionate rates of discrimination, violence, mental health challenges, and suicidal ideation. And public health experts emphasize that when governments target specific minority groups with restrictive policies, it sends a powerful message that those people are somehow less deserving of dignity, respect, and equal treatment, and research has demonstrated that. The sociopolitical climate and anti-LGBTQ legislation have measurable negative impacts on the mental and physical health of LGBTQ individuals, even beyond the direct effects of any specific policy, because the rhetoric and debate themselves create a hostile environment that increases stress, fear, and mental health problems. And we're seeing this play out in real time, with reports from mental health providers describing increased anxiety, depression, and suicidal ideation among transgender youth as they watch their rights and access to care being systematically attacked. And some advocates describe the current moment as an existential crisis for transgender rights in America, with one describing it as an obsessive focus that has been deployed across the entire Trump administration, appearing in contexts as seemingly unrelated as SNAP food assistance, where the Department of Agriculture has linked lapses in food assistance funding to Democratic support for what they call gender mutilation procedures. So what happens next? Well, in the short term, we can expect a flood of public comments during the rulemaking process, with medical organizations, patient advocates, legal experts, and affected families all weighing in. And given the strong opposition from the medical community and civil rights organizations, there will be intense pressure on HHS to withdraw or significantly modify these proposals. And if the administration moves forward with finalizing the rules, lawsuits will almost certainly be filed in federal courts, possibly within hours of the final rules being published. And those legal challenges will make many of the same arguments that have been successful in blocking previous attempts to restrict transgender health care, including that the rules exceed statutory authority, violate equal protection principles, and interfere with the parent-child relationship in ways that are constitutionally problematic. And courts will have to grapple with difficult questions about how much weight to give to medical expertise when it conflicts with political decisions, and whether the government's interest in what it claims is protecting children outweighs the documented harms of denying access to evidence-based medical care. And in the longer term, The outcome of this battle will likely depend on a combination of legal decisions, political developments, and public opinion. And while current polling suggests majority public support for limiting this care for minors, public opinion can shift as people become more educated about what gender-affirming care actually involves and hear from medical professionals and affected families. And there are signs that some of the most extreme rhetoric and proposals may be counterproductive for their supporters. Because even many Americans who are unsure about gender-affirming care for minors are uncomfortable with the government threatening doctors with felony charges or forcing hospitals to close their doors. And the fact that every major medical organization opposes these restrictions is a powerful counterweight to political arguments. And historically, when there's a stark conflict between medical expertise and political ideology, the medical perspective tends to prevail over time, though not always quickly enough to prevent harm in the interim. And we're also seeing some pushback from unexpected quarters, with gun rights groups opposing proposals to limit Second Amendment rights for transgender people, and some conservative-leaning parents who have transgender children speaking out about how gender-affirming care has helped their families. So the coalition opposing these restrictions is broader and more diverse than a simple left-right political divide. But we also need to acknowledge that the current political environment is uniquely hostile to transgender rights, with the Trump administration making this issue a central focus in ways that previous administrations have not, and with Republicans controlling both chambers of Congress and a conservative majority on the Supreme Court. The political landscape is challenging for those seeking to protect access to gender-affirming care. So in conclusion, what we're seeing with these December 2025 proposed rules is a pivotal moment in the ongoing battle over transgender rights in America. And the Trump administration is attempting to use the federal government's enormous financial leverage to effectively end gender-affirming care for minors nationwide, even in states where such care is legal and supported by medical evidence. And the proposals would force hospitals to choose between providing evidence-based care to a vulnerable population and maintaining their financial viability, which is really no choice at all for most institutions. And this is happening despite overwhelming support from medical organizations. Substantial research evidence showing benefits and safety of appropriate gender-affirming care, and serious concerns from legal and medical ethics experts about government overreach. And while the rules are not yet final and will face legal challenges, they're already causing real harm by creating fear and uncertainty that's leading to program closures and treatment interruptions. And the ultimate outcome will depend on how courts balance medical evidence against political priorities, how the rulemaking process unfolds, and whether public opinion shifts as more people understand what's actually at stake. But regardless of how this particular battle resolves, it represents a critical test of whether evidence-based medicine and individual rights can withstand determined political opposition, and whether a small, vulnerable minority population can maintain access to care that medical experts agree is necessary and beneficial, and for the transgender youth and families directly affected. This isn't an abstract policy debate. It's about their health, their well-being, and in some cases their very survival. And that's why this story matters not just for the transgender community, but for everyone who cares about the integrity of medical science, the limits of government power, and how we treat the most vulnerable members of our society. And as this situation continues to develop, we'll need to keep watching how the regulatory process unfolds, how courts respond to legal challenges, and most importantly, what happens to the real people whose lives hang in the balance of these policy decisions, because ultimately, behind every statistic, every policy proposal, and every legal brief, there are young people who are simply trying to live authentically and access the healthcare they need. And how we as a society respond to their needs will say a great deal about our values and our commitment to both medical evidence and human dignity. Thank you for watching this in-depth analysis, and I encourage you to stay informed about this critically important issue as it continues to develop.